Researchers investigate if the keto diet might help women with ovarian cancer. The trendy and sometimes controversial keto diet has become popular, with many hoping to shed weight while eating foods like bacon and eggs. Initially, the diet, which is high in protein and low in carbs, was developed to help epilepsy patients in the 1920s. Now, nearly a century later, researchers are looking to see if the diet can have other medical purposes, like helping improve the health of cancer patients. Researchers from the University of Alabama at Birmingham are investigating if the diet can help women with ovarian or endometrial cancer lose more body fat and reduce their insulin levels. What did the study find? Researchers examined 45 overweight or obese women with ovarian or endometrial cancer. They were randomly assigned to either the ketogenic diet or the American Cancer Society recommended diet, which is a moderate to high carbohydrate, high fiber and low fat diet. Compared to those who followed a low-fat diet recommended by the American Cancer Society (ACS), women with cancer who stayed on the keto plan for 12 weeks shed more body fat and had lower insulin levels. The research trusted source was published in Journal of Nutrition. But the experts caution that positive weight loss in cancer patients doesn't mean that the diet is a treatment for the disease. How can keto help? The keto diet limits carbs, which are known to increase glucose and insulin. It forces the body to burn fat as fuel. Some of the fat is converted to ketones, which are used by the brain and many other tissues as another type of fuel. Because cancer cells prefer to use glucose, diets that limit glucose may be beneficial, Barbara Gower, PhD, senior author and professor in the Department of Nutrition Sciences, said in a statement. Because they limit glucose and several growth factors, ketogenic diets will limit the ability of cancer to grow, which gives the patient's immune system time to respond. Previous studies have shown that the keto diet can have positive impacts on the development and outcomes related to cancer. First, it lowered insulin, which is a growth factor. Gower explained. High glucose diets result in high insulin, which stimulates cancer cell growth. Second, this ketogenic diet resulted in selected loss of visceral fat. Gower explained that visceral fat is the bad fat that resides in the abdomen. Having this visceral fat is associated with elevated risk for cancer and diabetes. Gower said the team also noted that patients with higher ketones had lower levels of IGF-1. IGF-1 is also a growth factor that stimulates cancer cells. The study authors want to continue the research to see if the keto diet has impacts on cancer treatments. Cancer fighting keto? Not